everybody knows that young babies get vaccines. But there are also two other platforms. One is the Adolescent platform between 11 and 13 years of age, and the other one is the older adolescent platform at 16 years of age. Meningococcus is a bacterium that, when it enters your bloodstream, can overwhelm you. And you can be fine 1 minute and dead 4 hours later. Antibiotics don't matter. It's too late. The only way you can prevent that is to have a vaccine to prevent it. That's it. And because you don't know who it is that's going to get sick or who it is that's going to be felled by this, you really need to vaccinate everybody. There are 2 vaccines that are used to prevent this terrible infection. And they're defined by the nature of these 5 different types of meningococcus. So one vaccine is called ACWY, which prevents 4 of the types. The other one is called B, which prevents 1 of the types. And if you look now, since the meningococcal ACWY vaccine has been around since the early 2000s, we've largely seen those types dramatically decrease. So now the most common type is actually meningococcal type B. If you take the B vaccine, about 55 people, 10 to 25 year of age person would be affected by that. That's not a lot of people, but it's a terribly devastating infection. I mean, about 10% of those who are infected will die, 15 to 20% will be permanently harmed. If you knew who those 55 people were, you could target your recommendation, but you don't know. And because anyone, therefore, is at risk, even the healthiest person is at risk, you have to vaccinate all to protect the few. I think the flu vaccine has been hard for people. For children, between 75 and 150 people die of influenza. Most of those children were previously healthy, died from influenza, died from a vaccine-preventable disease. So although it's not 100% effective, that's better than what your protective rate is if you don't get it. Because if you don't get it, the protective efficacy is 0%. The provider needs to make a clear, concise, compelling recommendation for how this should be done. Because they're listening to you. They count on you. They trust you. And I think that you then become the important person in that. And what I say to parents is, you don't want to become a member of a parent activist group, because all of those parents say the same thing. I can't believe this happened to me. I can't believe this happened to my child. And therefore, what happens to them is they become vigorous activists who explain to other parents about the importance of the disease and the importance of the vaccine. You don't want to become one of those parents. Teenagers aren't great about coming to the doctor. And they come periodically, however, for other reasons. They come because they're getting camp physicals, or they come because they're getting inducted into the Army, or they come for other reasons related to, say, school. Even though they're not coming in specifically for vaccines, that's an important time to get them the vaccines that they need, because they may not be there again. So I think we have to make sure as clinicians, we have to make sure as parents that when those children are there, that they get the vaccines that they need.